Well, happy, beautiful, amazing day. Welcome to this edition of the Dr. Bob Rakowski Podcast. I have nurse Georgie McNiff. Georgie, we go back 15 years, and what's so fun is, one, you look like the picture of health. You are the picture of health. You've lectured nationally. You've helped people with fat loss. You've helped them with hormones. You've helped them understand the pros and cons of something that's a really hot topic right now, which is Ozempic and GLP-1 drugs. But I want to go back to your history. Let's go back 15 years. What were you doing? What was your life like back then? And what caused this beautiful pivot?
Oh my gosh, yeah, 15 years is a long time. I remember my first phone call with you. I had just met my ex-husband, Dr. Kurt Waples, and I had every issue you could think of. I had skin issues. I couldn't sleep at all. Like, I could not sleep. I had such bad anxiety. My digestion was a mess. Like really bad bloating, gas, constipation, everything. It was like so uncomfortable, so terrible. And I mean, there were other things as well. I was anemic, and I started working with my ex-husband, and then there were just some things that we needed extra help with. And he was like, you need to see Dr. Bob. Dr. Bob is like the best, and he's who I've learned everything from. And between you two, my life changed. And I had seen so many doctors for everything, like allergists and GI specialists and neurologists for sleep, and no one was able to help me. And within the course of a couple of years, like 2 years, my skin had cleared up. My digestion was perfect. I could eat foods that I wasn't really able to eat prior to that. I slept every night for 8 hours. And I wasn't anxious and depressed anymore. And I was just like, this is radical. This is, 15 years ago, no one knew what a GMO was. No one knew what gluten-free was. People would look at you like you were crazy. Now everyone knows, and it's very commonplace. But back then, the type of medicine that you're doing now, that we're doing now, it was so novel. And so I felt like I had found this huge secret that no one else knew. And I was like, I have to, start sharing this with people. Like, people don't know about this. And all these other women who I knew had the same issues as me: skin, gut, sleep, anxiety, and they were suffering. And so, yeah, that's kind of how it all got started.
Well, let's look at the major levers. So you said so many things that are so valuable. And, it's actually estimated about half of the people, it's certainly in this part of the world, have chronic digestive issues. Now, interesting enough, you mentioned GMO, you mentioned gluten-free. I might ask you this question. You're trained as a nurse. How much typical training does the typical gastroenterologist have, those that specialize in gut, in diet? And what foods are good for the gut and what are bad? So how would you answer that? How much training does the typical gastroenterologist have based on your experience with patients that see them?
None. And I can tell you that when I got my nursing degree, there was one chapter on nutrition, and we didn't even cover it. They said, we're not going to go over this chapter. We're going to skip on to the next one. You guys can go ahead and read this one at home. We weren't even tested on anything.
All right, now let's go to you. So what changes did you make in your diet and gut that I think is a big part, right? So modern science says, believe it or not, 90 to 95% of everything that's in terms of ill health, illness, can go back to the gut microbiome. So what specific changes did you make, and what do you recommend for people now?
Sure. I guess it depends. It depends on the severity. I do remember a study from one of your lectures. I think it must have been like 10 years ago, but there were 3 different groups. Group A, they changed nothing. They were all diagnosed celiac. Group A, they changed nothing. Group B, they altered their diet. And group C, they added in nutrients and they altered their diet. And group A, that group had further GI barrier degradation upon colonoscopy. And then group B, that group did not have any further degradation, but their gut didn't heal. And group C, that did the GI healing nutrients plus the dietary component, actually had a reversal of inflammation and GI degradation. So we know that if we want to heal somebody's gut, we have to one, manage stress, because that can kind of kill all efforts. But then two, hit diet, and three, hit GI healing nutrients. And that is what I did while working with you. And that's what I do with my patients. I think testing has come a long way too. Like, I love doing stool testing. I've had multiple patients come in the past few years with ulcerative colitis and Crohn's disease. And we've gone on to do stool testing with them, and they have come back with a parasite. And their general practitioners and their GI specialists have not done any basic parasite testing on them. And so once you know what's going on, you can support the gut and the microbiome, and the immune system can fight off parasites, and you can see reversal of chronic conditions like UC and Crohn's. So yeah, that's the direction I usually go in.
Well, how wonderful. So just for the benefit of the audience, one of my mentors taught years ago, when it comes to toxins and parasites, it's not us against them, it's us with them. And if your body is strong and healthy and well nourished, they're not a problem. But as your body breaks down, toxins break us down further, parasites break us down further. So does your testing, by the way, also then give different agents, both natural and pharmaceutical, to kill the parasite?
Yes. So the testing that we do usually is stool testing, looking at different types of parasites. And then in tandem, I'll do chemical sensitivity screening. And we'll also do usually like a blood heavy metal screening as well.
Brilliant. And by the way, for the sake of people coming in here, the patient gets a kit, they collect the sample, they send it in. You don't have to handle it. Sometimes you tell people, you use those terms, I love to do stool testing. Well, actually, you love to work with the lab that does it. You love to
yes.
do that. And you love the information that helps people get better. So we'll be clear on that. So let's go to this weight loss thing. So, all the craze right now is Ozempic. And, we are seeing that people are losing weight, but there's a significant amount of weight loss that tends to be lean tissue. So let's talk about your experience with Ozempic, the people that are benefiting, and how can everybody that chooses to do it protect themselves against lean loss?
Yeah. Well, in our office, we use bioimpedance analysis technology. And so we get a baseline in regards to skeletal muscle mass and lean mass for our patients. And the expectation is that that number and that metric stays the same throughout their program. If for some reason someone is deficient in muscle mass, we will focus on putting that mass on them before they go into a GLP program, because there's no point in taking someone who already has a really low metabolic rate or who is skeletal muscle mass or lean mass deficient and putting them on a GLP-1, and potentially that has the side effect of a calorie restricted diet for the patient. They're not trying to restrict calories, they just do. And so if you don't kind of get that right in the beginning, you do see patients losing muscle mass, and then they can't get off the GLP-1s. And when they do, their metabolic rate has decreased because their muscle mass has decreased, and then they're more likely to put the weight back on. So it's just kind of waste of time, money, energy, and skeletal muscle mass. So that is the top priority. We work with our clients in terms of their level of activity and level of muscle mass. And then we support them in helping guide them into how many grams of protein per day they should be getting. And what's the best way for clients to divide that up? Because some people want to intermittent fast, and some people want to work out a lot and they feel like they need 5 meals a day. So it's our office's job to say okay, this is where you're at. This is your activity level. We think you need this many grams of protein per day, and let's structure it out so it works with your lifestyle so that you're more likely to do it. And it works really well. And we have also seen clients, almost every single client, go off the medication. So we will do 3 to 6 months on the medication. The maximum dose is never even reached, I would say 95% of the time. And so clients maintain enough appetite to actually hit their protein goal so they don't cut muscle. It's not a program that's for everyone. It's definitely never the first thing that I pitch to a client. The first thing that I pitch to a client is always getting labs done, doing a detox, working on diet, lifestyle, and stress, and supplementation, addressing where their inflammation is coming from and what's going on with their hormones. But there are patients who have been struggling and they want results right then and there. And I know if they don't work with us on a GLP-1, they're going to go to another clinic who's not actually keeping tabs on muscle mass and nutrient status the way that we do. And then patients come in and they're like, well, I've tried Ozempic and I lost all my hair and it made me really sick. And, we are leveraging the technology of the medication, but we use it as training wheels. And we tell our patients, like, we're putting training wheels on you. This is going to help you get the sugar out of the diet. It's going to help you establish better lifestyle and nutrition and supplementation habits. And the goal is to get you off of the medication. This is not like a for life thing. We're using it as a tool.
You said so many things that I love and I want to emphasize. And I believe everybody that's using Ozempic or seeing a practitioner should see someone exactly like you, because the data is, if you have quantification on where the body's starting and then you track it and you see things going in the wrong direction, we want to resolve this. So for listeners, I've been doing a little bit of a deep dive on diabetes and the connection between muscle mass and diabetes. It turns out that the more muscle mass you have, you regulate an enzyme, and I'll just give the word for the nerds out there, mTORC1. That's small m, capital TORC1. There's an mTOR category of, I guess we call them proteins, that do so much in the body. But when this is out of control, diabetes happens and the complications of diabetes happen. And the number one factor that keeps that in check is muscle mass and muscle activity. So it appears that people that if they want to keep the downstream effects of fat gain, diabetes under control, exercise is not optional. So you're tracking it, you're giving them great advice, you're doing what people should do. And then you said in terms of intermittent fasting, now, do people choose to do that? Do they come in saying, I'm doing this, it's not working? Do you give them guidance on that? What are your thoughts on intermittent fasting?
I do like intermittent fasting. I think I would say at least 60 to 70% of people come into the office and they are already intermittent fasting, and they have gotten a big boost in their weight loss on their own from implementing intermittent fasting. And, eating with circadian rhythm is, the new buzzword for intermittent fasting. Intermittent fasting was like, but what I came into medicine learning about, and now it's all like, intermittent fasting, eating with circadian.
Well, let's talk about that circadian eating. So describe that. How do people honor their natural body rhythm with their diet and what they're doing there?
Sure. So eating with circadian rhythm is basically eating with your hunger and satiety hormones, leptin and ghrelin. And so just like how melatonin is high when you're sleeping, cortisol is higher during the day, you want to kind of try and like eat with the natural rhythm of your body. So if you're having like your biggest meal of if you're starving yourself all day long, or not starving yourself, if you're intermittent fasting all day long and you get to like 3 o'clock and you're starving, what I see in my patients is then they eat late into the night and they're eating like dinner at like 8 or 9 o'clock. And I'm from New York City, so we eat dinner late. Like 9:30, 10 is very normal. But then what happens is you're going to bed with a full stomach and you're going to bed with your insulin levels really high. And your body can't burn fat when your insulin levels are high. Insulin's a storage hormone. And so you have people who feel like they're following a really long, good intermittent fasting schedule. They're only eating like, in a 4 to 6 hour window, but it's not doing anything for them. And they're not fueling their body like earlier on in the day. And that's an example of not working with circadian rhythm and not working with your hunger and satiety hormones. And there is new research that shows that, leptin and ghrelin, the regulation of your hunger and satiety hormones starts with sleep and your sleep-wake cycle. And so it's all kind of like interrelated. If I can get a patient to, like eat in an 8-hour fasting window, or to eat in an 8-hour window and then 16 hours of fasting, that's great. But I try to get them to kind of have a breakfast, have a lunch, and have an early dinner instead of having like a really late dinner. And that usually works a little bit better.
Well, one thing we know is that when we're sleeping, our brain detoxes. We even have what they call the glymphatic system, where the brain is just clearing stuff out. But if your digestion is doing effort and your body's repairing things, then your brain is not detoxifying. And interestingly enough, if people wait too long to eat, excessive calories is also a stimulation or a stimulant for insulin release. So you could eat the right balanced meal, but if it's too big, too many calories. In fact, one study showed that 1,000-calorie meal, that's a pretty big meal, but maybe not for some people, releases 3 times the insulin as the same content meal of 500 calories. So
Wow.
double the quantity and triple the insulin. So we don't want to overeat. And in fact, calorie restriction, number one mechanism of longevity ever studied. So we want to cut it early. Now, there's plenty of people that do intermittent fasting that say, okay, I can resist anything but temptation. So if I don't eat the first half of the day, then it's easier to intermittent fast for the last half or eat for the last half. But most of us would be better doing opposite of that based on what you're saying there.
And Dr. Bob, this is something that I just, started looking into, but I have heard that for women particularly, if they wait too long to eat, that because the body doesn't have calories to go off of, that the adrenals end up producing more cortisol so that, we have more kind of like more go. Are you aligned with that school of thought?
Absolutely. So there's so many things that go on when we're not eating. The body doesn't say, okay, I'm not going to make any more energy, use any more energy. So it has to start breaking down its own reserves. And one of my favorite studies was from the journal Carcinogenesis, break down that word carcino, like cancer, genesis, the origin of 1999. They found out that when the body's in a calorie restricted state, starving state, the first cells that a healthy body eats are precancer and cancer cells. So our body's going to break down the dead and dying and actually recycle them. And that's called autophagy, which is stimulated by intermittent fasting. But the longer you go without food, especially if you have blood sugar issues, your body starts releasing stress hormones. That can shut down metabolism. That can shut down the immune system. That can shut down joy. That can shut down digestion. That can shut down drive. They used to call it comfort eating. And then people can go for discomfort eating, bad choices for a dopamine hit. And we don't want to go there. So honoring your body, honoring your rhythm, honoring it with good food choices is right in line with what we're sharing. And perfect time for a commercial break. So talk about honoring your body, bettercoffeeshop.com, the best organic coffee in the world, good for insulin signaling, good for fat loss, good for alkalizing, good for anti-inflammatory, good for detox. By the way, half the world's coffee has molds, more than 70% has heavy metals, and 90% has herbicides, insecticides, fungicides. Ours certified clean and pure. Bettercoffeeshop.com. Try your box today. So back on this concept, you're very, very integrative with how you take care of people. So when you're using the nutrient support, do you have anything in particular that's your go-to for metabolism and fat loss or gut healing or even stress reset? What are your go-tos that you find most commonly beneficial?
Wow. Okay. Yeah. So, for my clients, it looks like a combination of a higher dose of berberine with a product called NeuroBalance by Nutridyne. Putting patients on berberine and NeuroBalance, which previously was labeled Crave Curb, seems to be really, really, really great at helping to improve gut health and helping to reduce sugar cravings and helping to balance blood sugar. So those two supplements I will use in tandem with one another. And usually I will, I don't know, I'm sure a lot of people out there know Dr. Bob's style, but Dr. Bob loves to detox and loves to talk about detox. And so I will set a baseline with my clients and I'll do a 7-day cleanse and they'll do 2 shakes a day, and the shakes that they're on are medical foods, and which ones I use just depend on, what's going on with my client's metabolic health. Maybe they need liver support. Maybe they need glycemic support. Maybe I need to put them on something just for straight inflammation. Maybe they're deficient in muscle mass and we need just a really hearty protein shake. So we'll set the baseline with 2 shakes a day. and then they're on a supplement regimen that helps with fat loss. And a lot of times that's Neurobalance, berberine. I love using chromium. It seems like every single client that I work with can benefit from chromium. And then usually just really hitting inflammation really hard works too for getting weight off. So using some type of like high potency curcumin supplement. There are a lot of different brands that I like that I've tried. And then using omega-3 fatty acids for inflammation as well, or sometimes some specialized pro-resolving mediators like an SPM active or a PRM resolve. And then for gut health, I have found that colostrum, collagen, and glutamine help immensely. And then the type of probiotic I will put a client on is largely dependent on what comes back from their stool testing or what their symptoms are. If they have like chronic diarrhea versus constipation, it'll be a completely different probiotic regimen. And let's see, you asked about fat loss, gut health, and what was the third? What was the third thing?
Stress reset. Stress is a big one.
Oh, okay, yeah, and stress. So stress, I will usually do an adrenal adaptogen for sure, like something that's ashwagandha based. I love Adrocet by Metagenics. And then I will also do, I'll also kind of like rotate stress support. So I'll have clients do something that's more of like a pick me up for a week, and then I'll have them do something that's more of a settle down supplement for a week. And I've really liked doing that as long as the client has mixed adrenal symptoms, like stressed and tired and stressed and wound up. If they're just stressed and tired, I'll put them on licorice support supplement and an adaptogen to kind of give them a pick-me-up. And if they're stressed and wired, then I'll do more like L-theanine. I learned a great melatonin protocol from you years ago. I've gone on to help like probably hundreds of patients use that protocol. I've been doing work in corporate health solutions with a couple of larger companies, and they have executives that are so burnt out. And I have used stress protocols for the stressed and like ramped up and stressed and wired patients, such as L-theanine, melatonin, magnesium, in a lot of those clients. And it's gone on to really change their lives because they're not able to show up for their families and their work life or themselves in a way that they want to because they're so burnt out. And so being able to get them on a stress protocol has been really life-changing. And that's been something fun to do lately, is get a little bit more into kind of a corporate health solutions situation.
You know, I have a patient that's what he does. He does, well, Brad Borkus, Epitome Coaching. He wants to work with super high level executives. Actually, he does work with them. And he said, Bob, if we could just buffer their stress and get them healthier, you know, their whole life, their whole business, their whole everything would get better. Stress is such a big player. Just by way of background, when people take melatonin, which people think of it as sleep, the gut makes 400 times the melatonin as the brain, and it actually puts the brake on stress as anti-cancer by 10 mechanisms. Theanine crosses the blood-brain barrier as a natural GABA facilitator. You mentioned magnesium. Stress kicks out magnesium. Most recently, I've used Ganoderma reishi spores. It took till 2022, even though it's been called the herb of spiritual potency, it actually reduces the amount of circulating cortisol in the blood. And we actually do that every waking hour. So back to these high-level executives, it's so interesting that even though they're burned out, they still drive. They don't seem to have a shutoff switch. So giving them a stress relief and a calming adaptogen. Tell me about some of the cases you've seen. What's a typical window to get these people respond, and how do they keep the benefits, you know, when they're so driven?
You know, it's funny. They all come in and they're drinking so much coffee. Like they'll come in and not like not good coffee, not like Ganoderma. Like they'll come in and they'll be drinking, you know, like 5 or 6 cups of coffee a day. Or more recently, I had an executive come in and he was drinking that coffee concentrate, the coffee that you're supposed to like put a little splash into water. He was just like sipping it. And I was like, how's that working out for you? Like, does that work? And he's like, no, it doesn't work. It used to, but it doesn't work. I was like, how long have you been doing this for? And he was like, oh, at least like a year or two. I'm like, so it stopped working a year or two ago and you are still driving your adrenals like so. And I told him, I was like, this is like slamming on the gas of your on the gas pedal of your car, but there is no gas in the tank. Like that's what you're doing when you are just like drinking all this coffee. It's a very like typical presentation because people start using caffeine to give them a boost when they start going into burnout, and it works for a little while, but then it stops working and they're just in this habit. And so first what I do is I usually pull the coffee out, and we have like a big discussion about it. And I talk about like how they just need to take a break because the coffee's not working. And if they take a break, they'll be able to have a cup of coffee in a few weeks to a month, and they will feel the effects of the caffeine again. And so that alone is enough to make a lot of people who really like coffee stop drinking coffee because they're like, it's not working. If I give it up and I go back to it, it will. And then usually once I get people on stress support, I'll also use like vitamin C. I love using vitamin C with glutathione just because stress depletes glutathione. And vitamin C is also great to replenish the adrenals. So put them on like a vitamin C supplement, an adaptogen, and then if they're kind of what additional stress support they need is kind of based on their specific symptoms. I love using your melatonin protocol. That's hourly melatonin and L-theanine. People usually feel better in 7 days. They usually feel a significant difference in 7 days. And if they don't, I'm like, okay, stick with it. Give me 7 more. And I would say like almost 100% of patients feel significantly better within 2 weeks. I haven't had any like energy patients go on a protocol and not have energy improvement at all. That has yet to happen. Knock on wood.
Yeah, as time goes forward, my standard protocol used to be 7 days. Now I pretty much go 10 with everybody I recommend. We're finding out that people, their diet is not as good as it was just a couple decades ago. Their stress appears higher. Maybe their exercise isn't there. You mentioned some major things about inflammation as well. Do you have any major tricks for sleep? Any protocol that seems to work well? Because sleep is a big one that affects maybe as much as a third of our population.
Yeah. Well, I will. If someone really can't sleep at all, a lot of times I'll do the Dutch test, the urinary test, just so I can look at their cortisol curve. Because some people, you start producing cortisol early in the morning and then it tapers off as the day goes on. But people who have an inverted cortisol curve, they won't produce in the morning and then they'll start hyperproducing before they go to bed, and they're not sleeping because their cortisol production is so high throughout the night. And for those people, I will high dose melatonin. Like we'll go up to 60, 80, 100 milligrams of melatonin. I have found genetic testing to be helpful. There are certain like genetic variants where people don't clear serotonin well. And so for those people, they actually need melatonin in very high quantities to help them produce the right amount of serotonin that will help them sleep at night. So genetic testing and cortisol testing works really well. But a lot of times, people might not want to they might not want to spend that type of money because the testing can be really expensive. And so what I found to work really well for a lot of people is to do GABA at night and then use magnesium L-threonate and combine that with melatonin. And that works really well for a lot of people.
Magnesium threonate, better at crossing the blood-brain barrier. That part is really, really good. You mentioned high dose 60 milligrams. I think you even said 100 milligrams. I know docs that are dosing 200 milligrams. No known toxicity of melatonin. And now, they even are calling it the vitamin D of daylight. It turns out that every cell receptor has melatonin receptors. They can trace it back in fossils a billion years, which is pretty amazing.
Yeah,
so,
anti-cancer, antioxidant that crosses the blood-brain barrier. I've seen some research studies that are looking into application of melatonin in dementia patients. I mean, it's pretty cool.
It really is. So what are you most excited about? We're wrapping down. What are you most excited about? And what's your final message for our listeners today?
I guess I would say that, I'm really excited because I feel like for most of my professional career, I've been in this industry now for like almost, for over 10 years. I just don't feel like functional medicine, which is really should just be called medicine, that it gets the attention it deserves. And I feel like functional medicine is having this like huge time to shine in the spotlight, and people are like finally realizing that the prescription drugs aren't the answer, and that really it's about like diet and lifestyle and proper supplementation. And I'm really excited that, you know, the types of people that are coming into my office are so different than the types of people that came into my office 7 years ago. Like it's just so much more mainstream. And that is really beautiful and really amazing, because it's just the way medicine is going, and it's going in a really great direction. I am launching an online program so that I can work with more people at once, and so thinning out my individual day-to-day patient book one-on-one in the office. And I'm really excited to be doing online group experiences with clients, just because it brings the cost down and it brings the value up, and people get to hear about, you know, what their neighbor in the next state is doing. And I'm really excited about that as well. So, yeah.
Well done. You know, there's a very high percentage of people, you just give them the right nudge, the right information, the right protocol, the right nutraceutical, and they can run with it, and miracles can happen. You know, thank you for an absolutely beautiful conversation. What's the best way for people to get a hold of you?
You know, Instagram is great at Nurse Georgie Health. And if you want to reach out to my office directly, it's admin@nursegeorgie.health. And that is great. So yeah, I'd love to hear your questions, and I'd love to see your comments below. And this was so great. It was an honor to spend this time with you, Dr. Bob. You've truly influenced my life and career so heavily, and I'm just grateful for your being.
The honor is all mine. And for our listeners, I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful.